everyone, and welcome to the fifth edition of Out and Loud Pune International Queer Film Festival. And thank you so much for all the love you have shown. We have got great response for today's event, and thank you for joining. I'm Shyam Konnur, the festival director and founder of MIST. I will be hosting the panel today, and we have some exciting people here who have worked in this field and are going to share all their knowledge with you. If you have your questions, do comment. We'll share the questions on our screen, and one of our panelists will pick that up and answer your questions. We have few questions that we received initially, people who didn't want to share. We will also answer those questions for you all. Before that, let me also introduce you all to our great panelists. To start with, we have John, who has joined all the way from Phoenix, Arizona, who has worked in this field for a really long time. Let me welcome John on the screen.
Thank you so much. It's great to be here.
Thank you so much for joining us today. John, I will let you introduce yourself so people know a little bit more about what you have done and things.
Sure. My name's John Cepero. I have been HIV positive for 33 years now. For most of my career, I've been working to help local communities end their HIV epidemics. I currently work for an organization called Collaborative Research. We provide consulting work, HIV planning, social media and marketing initiatives, and other activities to help people live healthy and well with HIV, to keep people from acquiring HIV, and to end the HIV epidemic.
Thank you so much, John, for joining us today and being part of this panel. We also have Shruta. Shruta has joined us from Bombay, and some interesting things about Shruta is when we first took part in I think Gulabi Mela, first time before we even launched Queer Bazaar, Shruta was someone who's like, why is all your prices so less? Increase it, and helped us. So sorry, I know it's a completely different introduction, but I will let Shruta also introduce herself related to this topic that we're talking.
Thanks, Shyam. In fact, thanks for giving that insight about me, because considering that, I come from the social development sector, a lot of people feel that, we are the kind of guys you go to and we'll be like, oh, haggle, come karo price kind of a thing. But I believe that when there is quality stuff that's out there, and when, you have a group that's investing so much as volunteers, I think thoda fair banna to banta hai. I switch between Hindi and English. So, yeah. But thanks for that introduction. I am Shruta. I work with the Humsafar Trust, which is one of India's oldest and largest LGBTQ organizations. I've been managing the research unit for over 10 years now, and my areas of interest are HIV, AIDS, and STIs, with a special focus on PrEP, post-exposure prophylaxis PEP, and with outreach messaging for internet-based communities. Yeah, I think that's about me. Thanks for having me here. I'm super excited for this panel. Mm-hmm. I think we lost Shyam.
I don't know.
Shruta, I think there's some network issue. I couldn't follow that. Sorry about that. Yeah. And yeah, I know you were explaining about the cost. No, but that really helped us a lot when because we didn't know how to price. That was the first time before even we launched our web store. So thank you so much for the advice. It worked.
I still have your fridge magnets, and now I have your mask, and trust me, I love all of your work. So yeah.
Thank you so much. So our next panelist we have is Harsh. Even with him, I have some stories to share. So welcome, Harsh. So Harsh, hey. I was at Mr. Gay India 2020, and we were competing with each other. But I got to learn a lot about these medical things, which I didn't know. And thank you so much for sharing with it. I know you have worked with different organizations in this field. I think I'll let you also introduce, so you'll be the right one to do that. Yeah.
So, my name is Harsh. I'm a baby when it comes to public health, especially in front of people like Shruta and John. So, I'm basically no one. I have been in public health per se, HIV, since 3 years, I think. I have worked with different organizations like FHI 360, YRG Care, the Girl Effect. But my focus is on digital outreach and how to implement HIV delivery and related services through online mediums. Yeah.
Thank you so much, Harsh, for joining us today. Thank you, all of you all, for being here. Actually, this topic is very close to my heart. I've lost few very close people due to HIV, and it means a lot for me. So I might also be one of them who's asking questions that come directly from me. So yeah. So we have been talking about HIV, I think, since since the early days of all the what you say LGBT movement that began in India, and one of the ways we got into this is through HIV intervention. According to the history that I know, correct me if I'm wrong. All of you are free to correct me if wrong. So I think, especially for the community, it's a very important thing. And right now, as we all know, that we are talking about PrEP a lot. So we'll start with that topic. And I see, sorry, I missed, I thought Vijay had not joined. Let me also introduce our next panelist. We have Vijay here. Vijay is from Pune itself, from where our film festival also belongs. And Vijay also runs a support group called Divine Desire. Let me welcome Vijay on screen, and also let Vijay also introduce. It'll be great if you can introduce yourself too, like others, so that I don't miss anything.
Thank you so much, Shyam. So, hi guys, my name is Vijay. I am based out of Pune. And of course, like Shyam mentioned, I run a LGBT support group, which is called as Divine Desires. And I also work for people living with HIV by individually counseling them. And my area of work right now is into PrEP, which I am doing along with NACO. And I am also working towards spreading awareness within the community. And yeah, so that's basically all about me.
Thank you so much, Vijay, for joining us today. And like I said earlier, we'll start with talking about PrEP, because I think that's very important right now. To also let you all know that I have been on PrEP since a year right now with Nari, but we got few questions which I was aware of, but I thought, let me wait for panel. Let me not jump excited when I received those questions. I didn't want to be excited and answer them on the chat when I received. So let's start with the introduction. As Vijay, as you're on the screen now, and you were talking about PrEP. I remember one. So could you explain some basic details of what PrEP and
Sure. So, talking about PrEP, PrEP is nothing but it is pre-exposure prophylaxis. So, it's a combination of HIV medicine. So, someone who is not actually HIV positive and they want to be, we always say prevention is better than cure. So, someone who is looking for a preventive measure, of course, we have condoms. But apart from that, we have something now. Medical advancement has got us PrEP. So by taking PrEP regularly, at a fixed schedule every day, one can save himself from contracting HIV. So this medicine develops, a shield against HIV within someone's body who is actually taking it every day, one pill. So that's a very basic thing about PrEP.
all right? So I mean, if anyone want to add anything to it?
Mm,
No.
I think I
Okay.
can add that it's for people who are at substantial risk of HIV. It's not for people who are not at substantial risk of HIV. I think that's one important point to add. Yeah.
Yeah. Good that we brought this up. So how do we understand who is in risk of HIV? Like, what are the criteria that you talk about? Like, obviously, I know that in personal experience, when I went to, I'm taking it from NARI, so just everyone knows in Pune, NARI is National AIDS Research Institute. So they are doing a research where they want to know the usage of PrEP in India, and okay, fingers crossed, I got it for free for a year. So we'll talk about that more. So even they were asking about certain questions to recognize if you're a person who is in risk of HIV. So could you explain a little more, Harsh? How do you define that?
I think I'll pass it on to Shruta. She has the
So
history of
knew this was
HIV.
coming my
She
way.
can give the whole definitions of key populations and this and that. So I like conveniently pass
Yeah,
it there.
Sure, I'll pass
thank
it on
you.
to Truth.
Got it. So, see, one of the ways to know if you're at risk is if you have a certain number of partners. I think NACO defines it as more than 4 partners in a month, or if you are into using drugs, be it injecting, non-injecting, if you are into sex work, so that's another risk criteria that you have to keep in mind. And if you are in a zero discordant relationship, which means that if you are negative and your partner is positive, so that probably definitely makes you at risk, or someone who should consider taking PrEP in the long run. All of these are indicators, but in the event that you feel that, hey, you know what, I have sex infrequently, and sometimes I'm misusing a condom, and if you perceive that you are at risk, you are a candidate. Okay, so I think self realization or self knowledge that I could be at risk, and I think this is going to make me feel safer, is something that is very important. So WHO has its amazing criteria, that can be availed on their app as well as on their website. You can play a little quiz. You can look at Yes For Me. Even they have a risk indicator. Am I right, Harsh? I think even they
Yeah,
have a risk calculator. If anything that indicates that you are at risk, you should consider it. But go for it if you think that I need that extra protection, makes me feel better, not worried. So totally.
I'll add just my 2 bits on self-perceived risk. That's very interesting term because while Shruta said it works very well, if you think you are at perception of risk, you should take PrEP. But the opposite doesn't work. If you have if you perceive that you're not at risk and hence you should not use condoms or PrEP, so that's a no. So self-perceived risk is a very interesting area to talk about.
Absolutely.
I think one
I
thing. Oh,
yeah,
I'm sorry.
sure.
I think one thing that I would add as well is that if you have recently had a sexually transmitted infection of some sort, you are at risk for acquiring HIV, and PrEP would be an excellent opportunity to minimize your risk.
Yeah.
Okay.
Thanks for adding. I missed that.
Yeah, as John is right now on screen, so let me ask this next question to John. So, like in India, we were not speaking much about PrEP. I don't like, at least now it is. Now we are speaking a lot, thanks to all Yes For Me, Shruta, Cepero, and many of them working towards it. I remember at least like 2 to 3 years back, some brand in Hyderabad started manufacturing, and they were all the queer community of Hyderabad being these brand ambassadors. Whenever you go to Grinder and go to Hyderabad, you would see these ads popping up. But even then, I don't think many used it or spoke about it. But when I spoke to my friends abroad, like US or things, some of them gave me very weird ideas of, no, you don't have to use it if you're not really active, or just use it the time you think it's active. I don't think it works like that with my experience of the research that I've done right now. So could you give us a little more broad?
Yeah, so I think when PrEP first came out, there were a lot of people who felt that it was going to make people who went on PrEP were going to be irresponsible and either not take the medication as prescribed, or were going to have multiple sex partners, and just there was a lot of shaming going on because of PrEP and who manufactured PrEP at the time and a number of other issues. Since then, we've come to learn, and I think especially in the United States, it's become much more acceptable for an individual to be on PrEP and show that they are sexually responsible and that they are respectful of their bodies and of other people. And now we'll see on Grindr or Scruff or other dating apps, we'll see that people are actually showing that they are on PrEP and that they're knowledgeable. And, you know, you talked about like limited knowledge about PrEP. And I think one thing that is probably maybe very similar is that many of the public health departments and governmental organizations here in the United States have trouble discussing sex and sexuality, especially when it comes to men who have sex with men or folks who are transgender. And so instead, we've really relied on people in our community who are on PrEP to learn about PrEP and then share that information with their friends and their networks. And if they're on Facebook or Instagram, what have you, somehow really incorporate that into their messaging. And that has worked really well for us to spread knowledge about about PrEP and increase the number of people who are taking PrEP.
Thank you so much. I've also heard, so all these questions are just, I have the knowledge, but these questions are just that are coming from people and what we have researched that people think. So I've also heard about side effects. Whenever people are trying to go and talk about PrEP or they want to start using PrEP, but we also get discouragement from people, say, be careful, the side effect. Luckily, I think I went to the right source. We had a lot of tests. They made sure I was fit or fine to use PrEP and a lot of things. So, I mean, it's okay. I don't want to point this out to anyone, like Harsh, Shruta, Vijay, or John. Anyone can pitch in because I know maybe sometimes we miss a point, and I think this is a very important point so that people can start. So anyone can pick it up and answer.
So I'll say two things, and then I'll pass it on to any of you. First thing is that to answer of any such questions is please ask your doctor. I mean, one thing that we have been constantly advocating is that please don't give advice, medical advice like side effects, etc., until and unless you're a medical professional, until and unless you know the medical history of a person. So that's number one. And honestly, answer to a lot of your questions will be speak to your doctor, but we'll of course address that. Second thing, you spoke about going through tests to get on PrEP and then side effects. So these two things are not linked. I mean, it's not like if you will go through your HCV, whatever test happens, it doesn't mean that you will not get the side effects that can be. So now pass it on to more senior people.
I think I'll pick this up. Talking about side effects, what we've usually noticed. So some people, some people will not at all experience any side effects when they start taking PrEP. However, for every good thing, there is a, bad part as well. And it's not always necessary that everyone will get these side effects. But some people who start taking these medicines, initially, they may experience headache, nausea, and very mild symptoms such as gastrointestinal problems. However, once your body starts to get used to this medication, once your system starts get used to these medications, these side effects eventually subside. This is not a medical advice, but this is something which I'm talking about out of my experience when I started taking it. So this is something which is very usually a very usual thing to happen with someone who starts taking it. And of course, if you have any symptoms when you start taking it, you can consult to your doctor. They will be the right person to address whether this is something to worry about or this is something which is usual. So yeah, to sum it up, everyone may have different side effects or may not have any.
Okay, so Harsh, you kind of put me in a spot because I was kind of going to talk a little bit about the literature that's available out there, and
That you can. You're a research person. Of
I'm
course, you
not.
can
I'm
cite
not going to.
literature.
I'm not a doctor. I'm not a medical doctor. So what I'm going to share is probably based on research studies that have been conducted. So look, as Harsh and Vijay have indicated, people react or behave differently to PrEP. That said, none of the side effects that are out there are long term, nor are they life threatening, nor are they in a state ki yaar, if I take this one pill, I'm going to crash for 4 days and then no one's going to see the right or the left of me. So all of that does not happen. People do experience mild discomfort that could be gastrointestinal. They could experience mild headaches, nausea, but all of that is something that can be managed if and when you should speak to your healthcare provider or doctor before getting on PrEP. The other thing that people generally tend to ask is, if I take these medicines for a very long time, is it going to have an impact on my liver and my kidney? Because of course, when we drink alcohol, to liver, kidney ko to kuch hota nahi hai. But PrEP say, there is a very good possibility people worry about getting livers and kidneys damaged. But that's also something to consider. Ki all of these drugs have been studied extensively. The damage that is the damage in quotes that is sometimes visible in most instances that is reversed, especially with bone density. It is not particularly toxic to the liver. And there are different combinations of PrEP that are now available. Like you have TDF, which is one combination. In the event that you have ongoing kidney issues, you can request for another combination which contains TAF. To speak to a doctor. Just don't kind of get off anything, or don't avoid PrEP as oh my god, it's going to damage my kidneys, because everything out there, every research study out there indicates that PrEP is safer to take. And the other way to look at it is, if not PrEP, at some point of time, if you are at risk, you'll have to consider ART, right? Like PrEP at this point of time may be a choice, but ART literally comprises one more drug, over PrEP. And if not that, at some point of time, it's going to be this, So that's something that we need to weigh. And in both instances, it's safe. It's nothing that's going to cause a lot of issues.
That's
I just have
that's
one
a
more
very good
thing.
answer. Yeah, sure, sure.
Sorry. When I say like go to your healthcare provider, go to a queer friendly healthcare provider who understands PrEP. I have seen enormous outrage from physicians and from doctors of all sorts who say the same thing that Shruta is saying, oh, it's going to damage your kidney, liver, etc. And a lot of doctors are also against PrEP for whatever reasons, personal choices, or any research or anything they believe in. So it's very, I mean, your general physician might not be the right person to go for PrEP. That's what I'm trying to say. I mean, go to physicians who are friendly and who advocate for PrEP.
Yeah. So, sorry. Yeah, someone had to say something. Okay. So, John, could you just add more and say what are the tests that are generally carried on before using PrEP? And yeah.
So I'm not a medical provider. So I do know that first you're going to have an HIV test to make sure that you're HIV negative when you start this. And then typically they do a blood draw to run a series of tests to make sure that your body will adopt well, that it's not going to, like the impact on your body taking medication is going to be minimal. The thing that I would add to folks is that anytime we start something different with our body, if we start exercising when we haven't done that before, there's a side effect. My muscles hurt tremendously, right? If I start drinking coffee or tea and I never drank those before, there's a side effect. I might get a headache. I might do these things. So anytime we do something different to our bodies, there's going to be like a little bit of a reaction at some point. And just starting PrEP is starting a new medication. You might take a new vitamin or something like that. There is a potential for you to feel differently, but I think that diminishes very, very quickly in a short amount of time. And for some people, that's not true, but for the vast majority of them, they are. Then as you continue on and you take PrEP every day, you're going to have to go back to your doctor every 2 to 3 months and have your blood work, your labs done again to make sure to just monitor your body and make sure things are okay. Also, other things, if you're sexually active, they'll probably want to test for STIs at the same time that they're testing for HIV. And it's really important, I think, to remember that PrEP is specifically for protecting yourself against HIV. It does not protect from other STIs. And so you need to have some consideration around that as well when you go on PrEP.
Yeah, thank you so much for adding that. Just my experience on being on PrEP is PrEP is not an alternative to condom or other safe-sex practices. And yes, luckily, because I had such a good organization I was dealing with, I had a reminder every 3 months calling me and making sure, come today. So that way I didn't miss all my tests and things. So I think the project is still on. If there are people from Pune here, you all can still contact Nari and get on PrEP. So we also have some questions that are coming up. I will share it on the screen. One of this, I think Shruta can pick this up. So I'm sharing this right now. Shruta, can you see the thing?
I lost the question. It came up. Okay, there it is. Okay. Okay. Right. So the question is, lesbians don't have any HIV risk. So that's that. So look, there are many ways in which HIV can be transmitted. There are, like, if you're talking about sexual intercourse, yes, probably when women have sex with women, the probability of acquiring and transmitting HIV is very less. But in the event that someone is, into substance use or is into, let me say, is probably a healthcare provider who works with high risk communities जहाँ पे blood draw होता है. So there are different ways in which people can be at risk. So yeah, so if you're talking about sexual, yes, there is very limited risk of HIV transmission. But then there is substance use, there is tons of it. So when you say PrEP is available only for gay men and transgender women, it depends on which context are you talking about. If you're talking about a research study that's happening at NARI, that, to my best understanding, is only for men who have sex with men and transgender women. But then if you look at things generally, it should be available for everybody if they want to buy it on their own. Sham, your voice is gone.
Sorry, I was on mute. I do this always.
That's me most of the times. I'm so glad when it always makes me happy when someone else does it. I'm like, yes.
Yeah. So I will say thank you so much for that. It's a very good answer. And I think that this is not the only, we had 2 more people asking the same thing in the anonymous thing. So good, it has been answered that lesbians don't get HIV was the question that we got. And also
lesbians don't get HIV, not true. Lesbians are at less risk of HIV in context of sexual intercourse.
Yeah,
absolutely.
no, I mean, the question
was
sorry. No, that was the
There are
question.
different ways in which one can acquire HIV. I think that's an important message to stress, because a lot of people look sexual transmission is probably the most common route in India. But there are other ways in which people can acquire HIV. It can be via infected surgical instruments, it can be via needles, it can be via blood transfusions, which is not as much in India anymore. Yep.
Yeah. So I think there is another interesting question. So I'll share it, and any panelist can pick. I can read it out loud as well. So the question is, how can a HIV positive person who is on regular medications understand when to change their medicines to another combination? So I would like someone to answer this, because if someone close to my family also had faced this issue. We didn't work out that ART medicines didn't work. So then we had to go to a private clinic, understand what's the issue, and take it.
So I have had the experience, I've been taking HIV medications now since, I think, 1998, so quite a long time. And I know that with my first regimen, after about 1.5 years, I did start to notice changes in my body, how I felt consistently over time, digestive issues, things like that, and approached my doctor, and we noticed that the medication really wasn't working for me anymore as well in terms of addressing my HIV. And so in talking with him, I have an equal voice in my medical treatment as my doctor does. And so I've been really great to find doctors that want to be a partner, a collaborative partner with me, and allow me to make the decisions about what I do to manage my health and wellness. And so I made the choice to change a medication. And so far, actually, for quite a long time, I managed that one as well. However, that medication combination was multiple pills. And while it was quite effective and I was undetectable consistently over time, when new once a day regimens came out where I could take one pill as opposed to multiple ones in the morning, some in the afternoon, one in the middle of the day, I could take one pill and it would be great. That opened up and made my life so much easier and made it easier to remember my meds and travel and be discreet with them at home and what have you. And right now, I know that injectable HIV medications that are long-acting over the course of the month are starting to be made available at my medical provider, and I'm thinking about doing that as well, only because again, my medication regimen right now is working and it is only one pill a day, but, that convenience is great. I think you have to really assess for yourself, am I feeling healthy? Am I feeling well? Is this complementing my life and my health? And if it's not, you need to talk to your doctor and ask if there are other options for you in terms of medications that you can take.
Okay. In that case, I have a question. Maybe I'll point it out to Shruta. Shruta, do you think we have in India like ART? I mean, anyone else also can pick it. I'm sorry, I'm pointing out. Do you think if someone goes through this problem in India, and do we have such options in ART centers to change medicines, or is it something only one that is free that we have to access?
Right. So, with HIV interventions, I do have my share of grouses and arguments with them. But at least as far as regimes go, moving individuals from first line to second line to third line, whatever, all of that is covered by the government. You wouldn't have to pay for any shift in regimes out of your pocket. And the way we would monitor your progression or your response to your medication is with CD4 tests, okay, which is basically like a white blood cell that they count, and your viral loads, how many viral particles are there in a unit of blood. And once you're placed on medication, if you are adherent and if everything's okay, you should be virally suppressed, within an X amount of time. So when in the event that that does not happen, your doctor will probably guide you and advise you, and ask you, have you been adherent? Have you had any other health conditions in the meanwhile? So they will take a detailed history before they kind of decide to move you on to another drug. But that definitely does happen within the Indian context even right now. And a lot of people get worried, there is some sort of a fear within communities that, oh my god, if I move from first line to second line, it means it's a problem, and they should not be changing lines. So a lot of people sometimes they show resistance because they've probably lost friends in the earlier days. But it's very important to remember that shifting lines does not mean anything. Okay, I mean, what is considered first line in India is probably not used outside. What is considered second line in India is probably first line somewhere else. It's just that they're moving you to a different set of drugs. And there are many drugs out there. It's not like, you're ticking things off a list and, oh my God, I'm going to have no drugs left after some time. So that's not going to happen. So it's best to kind of, touch base with your healthcare provider and as John indicated, even if you aren't feeling okay, sometimes we don't even wait until people show compromised CD4s or viral loads. If a person shows very severe reactions to a drug, even if everything's okay and if the person's not feeling fine, the person's shifted to a different regime. So I hope that answers.
Yes, it does answer, because in my personal experience, the medications outside are very expensive for the ART. Like similarly to PrEP as well. I'll come to that topic. I know we have moved from PrEP to HIV, but good that people are asking questions. So we have another question. I'll share that on the screen and read it out. So the next question is, hey panelists, are there any specific medical conditions when you can't take PrEP, like blood pressure, diabetes, etc., or is it mostly safe for all? Anyone can pick it up, whoever wants to answer this. Maybe Vijay, you want to pick this? Okay, Shruta, go ahead. No problem.
This is where I'm probably going to go by the advice that Harsh gave, speak to your doctor. Yeah, I mean, and not because, look, when we talk about blood pressure, diabetes, all of it is a range, right? There are different situations that give rise to diabetes. There are different conditions due to which a person could experience high blood pressure. I think it's important to consult a healthcare provider at this point of time, who then probably will look at other medication that you are on, and then decide. In most instances, things can be figured out, but I'm going to take Harshka, tap out card at this point of time and say, no, this is what needs to be done. John, Harsh, Vijay, any thoughts on this?
Yeah, I think I will also go with Harsh that, of course, you need to consult your medical provider, and tell them about your existing conditions. In most of the cases, when someone goes for the PrEP and they try enrolling themselves, the basic tests which are done are on their kidney and on their liver. If in case those functions are right, I think in most of the cases we will have some sort of management for other illnesses. However, if your kidney and liver they have some problems, then your medical provider may think about advising you PrEP or PEP.
Okay. So are there variations even in PrEP, like ART, for different conditions, lower, higher? I don't know. I'm asking any of you. You can answer, Vijay, or yeah.
I think Shruta or Harsh can answer this.
So, I mean, what I know is that there are three variations of PrEP that are available. That's what I read in the recent. So, one thing is that India doesn't have PrEP guidelines officially. I don't think they're done yet. I mean, Shruta might know better. Not yet. Yeah. So, we basically follow WHO guidelines. So, what I know is that there are three different combinations that were agreed to be prescribed. But I don't know how they differ. I think Shruta can tell better, like how these PrEP combinations, three combinations, they differ from each other.
Sure, you
So
want to
I
pick?
think out of the see, there are regimes and then there are combinations. So I
Yeah,
kind
regimes.
of
Yeah.
don't want to get a little technical, with everything. Look, with combinations, I think the injectable one is currently still being tested. It was supposed to be out by I think mid 2021, but COVID has really pushed back and taken away a lot of focus on HIV. So that's out. TDF and TAF are very similar, just prescribed in very different situations. In the event that someone has compromised kidney functions, I think TAF is recommended at that point of time. And with regard to regimes, I believe that it's we have the option of intermittent, we have the option of intermittent, which is event based, and then you have the regular one. But again, in all of the situations, going back to again what Harsh said, India currently does not have guidelines, right? India currently does not look at I mean, I would say it does not look at. There's definitely a lot of interest. There are research studies that are ongoing, but I think we will be looking at the old-fashioned long-term PrEP, where we take one pill a day every day, and the other options will be explored as and when we have more evidence within the Indian context. But yeah, and the guidelines are there. Okay, I think they're almost done. It's in some cabinet somewhere, waiting for
Some
the
file
world
in
to
NATO.
stabilize. Some You said that, I didn't. Okay, so
It's okay. I
Yeah,
don't care.
right.
No, but it shouldn't take too long really for PrEP to now come in as a part. But yeah, I hope that answered the question properly because I didn't
Yeah,
want
Yeah,
to
I'm
like
sure the guidelines will define everything.
yeah, but I think for a lot of us, all these terms are like just flying away. We don't.
I
So
was trying not to do that, you know.
yeah, so
Yeah.
we have one more question. So I'm sharing it right now. Lastly, what are the ways as a non-medical folk for us to educate more people on PrEP?
To educate themselves, I'm like to
More
know more.
people. No, to educate more people about PrEP.
Uh, oh, okay. So you want to be a PrEP advocate? Um, no, tons of ways. I mean, there is plenty of content on PrEP that is available on various websites and credible sources, double quote credible sources. You can share that on social media. You can share that on WhatsApp. Be like Sham, become a PrEP advocate, set an example. I think these are some good ways. Um, Website dossier of contacts. Dossier of contacts, I don't think such lists exist. The good idea will be to go to NGOs like Humsafar Trust or YRG Care or India HIV Alliance, who are working on PrEP and HIV. Websites, plenty of them, Indian and outside. For Indian, not so many actually, but outside there are like a lot of websites to know more about PrEP. But go to the doctor. I mean, if you need solid information and if you really want to consult, don't believe anything that's written on the internet. Try to always verify it from a healthcare provider. Self-diagnosis should not be our approach. That's I think I want to conclude. Yeah.
Yeah. So yeah, moving on. I think we moved in from PrEP to went into HIV also a little bit. So, but related to that, I would like to ask, as we run mist, we have been getting like recently a lot of cases where people come to us after they have had what do you say, unprotected sex, and then they say help us, and we go. Some of them really can't afford, so and or they are scared to go to any of these, even if it is a community-run organization. There are a lot of centers in Pune as well. They're scared to go alone to these places, so we have to take them. So can you all like advise more on this? Luckily, we have some doctors on call, and PEP is available without what you say prescription as well. It's, as far as I know, if you show a message from the doctor that, I mean, they are okay for doctors speaking to them most of the time. I know that without prescription, both are not allowed, PrEP and PEP. But at least, luckily,
Officially.
yeah. So at least they're giving it out to us as we speak to doctor at the center, because we have doctors on call. I'm just talking about the situation that we have at MIST right now. And also, we have a very close by a medical place. I don't know if all of you all know, it's Sassoon Hospital has a medical shop where we get it at a very reduced price, like a 50% cut on the medicine. So that is also helping us. So could you give us more idea on how people can talk about this more and be conscious and little bit about PEP as well? I know I asked so many questions. It can go one by one, and yeah, anyone can pick.
Uh, okay.
Why don't-
So yeah, please go ahead, John.
Oh, I was just going to say, so you're talking about post-exposure prophylaxis.
Yes.
So somebody who's had some sort of encounter that has put them at risk for HIV wants to begin emergency medications so that they don't get HIV. So if that's the case, you do need to start those medications within 72 hours of when you thought you were exposed to HIV. So you can't wait a long time. You really, really, really have to act quickly once you realize, once you're scared, what have you. You do need to move on that quickly and do that within 72 hours of when you thought you were exposed. And really what it's involved in is first, you're going to have an HIV test. And the reason for that is to just rule out that you're not already HIV positive and didn't know it. And then after that, it involves taking an HIV medications for 28 days straight. So you do have to take the medication as it's prescribed every single day for 28 days. And then you test again for HIV after that. And then with some further testing later on, again, like the next month and every 3 months, and however you get tested for HIV to do that. There are a variety of different medications you can take, so it's really important to just talk to your doctor and figure out what treatment is right for you in this particular instance. And that also may be determined by what you might be able to get for free or for low cost or what have you.
Okay.
Also, I want to add that you should be honest with your history. If you have taken PEP in past, or if there have been one or multiple unprotected sex. So I think that needs to go out very clearly. I mean, the provider level perspective, what I've heard is that when people go for PEP, the major complaint that providers have is that people are not honest with their histories, and that can lead to a lot of complications. So I think it's very, very critical that you be honest, and if you're going to a non-judgmental place, it should be all right.
Mm-hmm.
Right.
Yeah, I think that is the point, that they're very scared of always being asked questions that they're not comfortable or being judged. So recently I've been to at least 2 to 3 cases. I had to go with people because they're very scared. Even if it is a place run by the community, they're very scared to go there and access the services.
So I'll give a very controversial perspective to it. And I don't know how many of you will agree or disagree, but because of telemedicine guidelines, you actually don't have to go anywhere. You can get your test done at home, and you can get on PrEP or PEP theoretically. Doctors would prefer to see you for counseling and person-to-person interaction to really understand who you are and judge better if you are a suitable candidate for PrEP. But because telemedicine guidelines were launched in the wake of COVID-19, you don't have to go to a doctor. A lot of doctors will be angry, but that's the truth. When I was working with Yaswami, we got more than 50 people on PrEP, not even single one seeing a doctor in person. Everything was online, all tests were done at home, counseling was on phone, and so what I'm coming to the point is that if you're not comfortable seeing a person face to face and imagining how judgmental the person will be, there is an option of telemedicine. I don't know how many doctors will agree to it, because we also had a very hard time finding doctors. All the senior doctors, of course, said no. We are not going to do it. But we did find younger doctors. We were able to train them, and it worked out well. So I don't think hesitation, and of course, good counseling and peer support like Mist is doing, I think that helps in encouraging people to actually go and access PrEP or PEP.
Right. I completely agree with her. Yeah, I don't think that's controversial at all. In fact, a lot of things are moving towards telemedicine. And in fact, the way you've had experiences of having to get people on PEP in the middle of the lockdown, we've had to do that with ART. We've had to get
initiate
people,
ART.
Exactly, initiating ART when the lockdown started was probably some of our most, and luckily we did have a few doctors who agreed to consult the person over phone and get things over. The only key thing to remember here, Sham, is that do not forego that medical opinion, right? In the event that you've required PEP in the past, and you go like there are 5 pills remaining in that bottle, and then 3, 4, 8 months down the line, you go like another condomless episode, and like, oh, you know what, that worked the last time. So let me just start the same regime again. I mean, no judgment here. Trust me. When I get a cold, I will use that same Saridon. That I've whatever. Like, I mean, you know what I mean. That's what a lot of us do. We are very jugadu as people, and we are like, that worked the last time, so it's going to work again. So I'm going to take the same medicines again, but that doctor's opinion is important, not because he's trying to get like 400, 500, 800 rupees, whatever of you, but because there are a lot of other things that need to be monitored before you are put on PEP.
Yeah.
That's where
Doctors
counseling is
can
important.
sometimes,
That's why
yeah,
doctors say that you must be counseled. And I mean, that's where they will tell
exactly,
whatever Shruta is telling
exactly.
right now.
And with the counseling, there are other contraindications like hepatitis B. You need
Yeah.
to get tested for that before you get on PEP. So don't miss that, okay? And before anything else, I mean, since we've mentioned hepatitis B, people please get vaccinated. It's one less STI to worry about. One less drama in life, and it's preventable. So do get vaccinated. See your doctor. Please do not
So,
continue from the same old bottle. Please, it's a
so
request.
there
Yeah.
was one
I
question
would
that you
like
had
to add
asked
one more.
about the. Yeah, please go ahead, Vijay.
I'm sorry. So yeah, I would like to add one thing. So on the ground, I also get patients who, I mean, like people who actually had an unprotected episode, and we need to understand one thing. At this point of time, when we have actually went through unprotected sex with someone, the time plays very important role. So if you're hesitant, you're wasting very valuable time. So because you have to connect to the PEP treatment, you have to start taking your medications within 72 hours. The early you go to your doctor, the early you start taking medications, better are the chances that you will not get the HIV infection. So we need to remember one thing. I mean, like it may help you to actually go ahead and connect faster, is that it is always better that you take advice of your doctor within 72 hours. If you lose those 72 hours, you may have to regret your entire lifetime and take ART medications for rest of your life. So I think that can give you a very good start to go ahead and speak out openly. And the challenge here could be not finding a
Provider.
professional, yeah, a right person to speak with, and that's very important. So if you know someone who already has the knowledge of all these medications, and who knows who to contact, right contact is very necessary, so that the faster you get connected with a proper healthcare provider, you will be able to start your medication soon. Most of the doctors, if you go to a general practitioners, they don't know about PrEP and PEP. They don't even know about the combination. This is my personal experience. I've been to doctors who don't know about PrEP and PEP, and then at this point of time, you need to see someone who is specialist in that.
So I had a question about, because we are running out of time right now. So I'll first share two questions that we received from audience, and then last we'll talk more about how to access PrEP. So before I ask that, let me share the question from audience. If someone is facing any side effect, till not heard anyone, but do we have any research in homeopathy medicine? Who would like to pick this up?
I think Shruta research. Can you
Okay,
connect?
yeah, this okay. So, look, one of the challenges with homeopathy medicine is that there is no research. Okay, I mean, I do know that a component of Ayurveda, a component of Unani has worked for some other things in my life, but it but with regard to HIV, with regard to STIs, with regard to a lot of PEP prep related areas, okay, we do not have research in homeopathy. So anyone who tells you that, hey, you know what, there is a lot of side effects with ART, please take this and this is going to fix HIV or this is going to make things better. Look, if something works for you, excellent, okay, but at the same time, your ART, your PrEP, and your PEP, whatever combination you are on, must not be given up. Okay, speak to your allopathic doctor. I know a lot of allopathic doctors can be very, very dismissive of alternative medicine, but in the event that you want to start or stop any alternate medicine, do consult them, because none of these alternate medicines are proven to be effective, okay, on their own in managing HIV, in preventing HIV transmission. So yeah, so no research yet, and definitely not a recommended route in case you are experiencing side effects. Those can be managed, but don't give up on your regular course of medicine, you know, in favor of alternative medicines entirely.
Great. Um, we have another question. I'll share that. Yeah. If someone had protected sex with HIV positive person, So there are less or more chances to get HIV positive. If yes, then that time PrEP will help.
Oh, it's a very complex. So, John, would you like to take that? I think.
Yeah, so I think we need to kind of break this up a little bit.
Yeah.
So if someone had protected sex with an HIV positive person, is there more or less chance that they may get HIV? And I would say if it was protected sex, the risk of getting HIV from that individual is very low. And if regardless, PrEP is still a great opportunity here because we're all human, and sometimes a condom may break, you may forget to use one, something may happen, and in those instances, PrEP will provide additional proven protection against getting HIV. And so you know, the other thing that's really important to look here is if the person who is living with HIV is taking their HIV medications, and they are called, they've been told by their medical provider that the amount of HIV in their body is so low that it's very difficult to measure. They have very, very, very little risk, actually little to zero risk of passing HIV on to someone else. So it's a complex question. If somebody is HIV positive, they're taking their medications, the amount of the HIV in their body is low, they'll have zero risk of passing it on. If you're having protected sex with an individual, there's low to minimal risk of acquiring HIV. And if you're on PrEP, you've added that additional layer of protection, especially for those moments where it might be difficult to make choices that would help protect you.
Thank you so much, John. I think we have another question. Again, it's for you. Shruta, did you want to add something?
A quick one. You know, think of it as going out in the rain with a raincoat and an umbrella. Okay, the umbrella also does protect you to an extent. The raincoat also does protect you to an extent. And when it's PrEP and PEP, it's both. You know, so it offers you, like, it's just ensuring more protection, keeping yourself safer. And yeah, but don't do that with condoms. Doesn't mean you use two condoms. No, it's yeah. I had to put it out there because then people will be like, oh, sweater ki tarah hai, do laga. So, you know, so yeah.
Yeah, true. I've heard of such things before, so you're right. So I'll share the next question. I think mostly it's for John. Recently, during COVID, we have been seeing news about this. So it says there is recent update of cure for HIV in the US. Any more update? And also, I think I've seen some articles about vaccination being coming up very soon. It's under testing or something like that. I saw some articles about it. I'm not sure how true it is. That's why I've not shared it on any of my social media. So you can add something to it. Yeah.
So I don't know how much I can add other than that. I think that a lot of folks that I work with in the communities that I help with their work are very upset that a cure for COVID, the vaccination for COVID, was developed very, very quickly, but now we're here 40 years in the HIV epidemic and we're still waiting for the vaccination. And, you know, the answer that I share with them is that it's not an equal comparison. They're two very different things. And people have been working on a vaccine for HIV for quite a long time. And I think what you may be hearing is that there are some clinical trials going on around vaccines. There have also been clinical trials and actually new HIV medications that are injectable and provide HIV medication in your body for about a month. So you don't have to keep taking a pill every day. I would say right now, the best thing to do is until you hear a worldwide news story that there's a cure for HIV, just know that people are working on the cure, but it hasn't come yet in that way.
That's such a good way to put it, you know, John, because is there a cure for HIV? People, there are researchers who are constantly trying. Okay, since the time the virus was discovered and we knew what it was, people have been trying to cure it. People have been trying to fix it. And the way a lot of trials go is that there are at least three stages, and every time there's the minorest breakthrough in phase one or even phase zero, sometimes media will report that there is a cure on the horizon. And sometimes the media goes so ballistic. I remember that when there was the AIDS conference happening in Sydney, the Malaysian Airlines that was traveling to Sydney crashed. A lot of people, a lot of delegates to the conference passed away. And the way the article was reported was, we potentially lost a cure for HIV. That made me so angry. I was like, okay, this is not how things are. So we do have successes. People we pass some stages in the trials. This many, but as John said, right now there is nothing concrete that's on the horizon except what we already know. So we can just keep hoping and keep the good fight on. So, yep.
Thank you so much for putting it across so well. Before we end, we have a question by someone. Jibi asks if it's okay to take COVID vaccination and if people are on HIV, PEP, or PrEP. Jibi, I would like to answer that we have a special session for this about vaccination and COVID in 2 days, and we have a doctor. The separate section will only explain about the COVID vaccination and everything about LGBT. Please join us, and we will answer all your questions in our next vaccination. In our next session, not vaccination. Yeah, so we'll be answering those questions. Also, before we end, I would like the panelists, if we have missed something, if you all want to add something about PrEP, PEP, or HIV, it would be great before we end if we can add something.
So I'll just talk about cost and process very quickly because
Oh yes, I
have
forgot.
seen.
I told you we'll talk about that at the end. Thank you, Harsh, for adding.
No,
Yeah.
I think it's important to talk about that because all our questions and answers are only relevant if you're through that. These are the two reasons which are barrier to people getting on PrEP in Indian context. One, the process. Second, the cost. Right. So when it comes to process, that was another question: what tests you should go through, etc. One is, of course, the HIV test. So you'll go to the doctor. Okay, he will say, okay, I am at high risk. He will determine by counseling. Okay, do you have multiple partners? Do you engage in transsexual sex, etc., etc. Like Shruta explained. And if you are at high risk, he'll say, okay, he or she'll say, okay, or they will say, okay, that these are the tests you need to do. So you need to do your HCV, hepatitis B, hepatitis C. You need to do your VDRL, which is syphilis, HIV. Ideally, all STIs you should take. But the doctor will decide based on your sexual history. Apart from that, creatinine, which will cover your liver function test and kidney function test. So it's a bunch of tests. It's not less. Once you do these tests, you'll have to visit the doctor again or speak to the doctor again, show all the reports and say, this is what it is. And it is standard process. If you have other medical conditions, of course, this route might be different. Then they will give you a prescription and they might prescribe you only 1 month or 2 months of medicine because they would want to see if you're adhering or not. You can take that prescription to any provider which is offering, which is providing PrEP or PEP, and you can show that prescription and purchase it. You can also purchase it online, 1mg.com, NetMeds, and I think almost all online pharmacies are providing. You can order them online and you can upload a prescription. Once you receive your medicines, you can start. There might be check-ins on adherence that you're taking it daily or not, basis whom you have taken it for, and what is their model of care. Um, and every 3 to 6 months, you should ideally repeat most of your tests. So that's the overall process. Coming to cost, all the tests roughly can cost you something between 900 to 1100, the cheapest. The cheapest way or the cheapest model to get these tests done is Healthians. I'm not being brand ambassador of any brand, but I have compared rates of these tests almost everywhere, and Healthians give you the cheapest, and you just need to haggle with them a little bit or to their phone coordinator, and they might keep giving you a better price. So these tests are going to cost you something like that. A doctor's consultation can be anything. If you're going to a high profile doctor, of course, they will bill you more. If you're going to not so high profile doctor, they will bill you less. And if you're going to charitable organizations like Humsafar, it might not cost you anything at all. Coming to cost of PrEP, which is one major problem, pharmacies will sell it to you. I'm talking about tenofovir combination. They will sell it to you for around 2000, 2400. That's what I've seen. Um, if you are getting it online, you can get some discounts and they can come up till 1800 and 1900. But if you're going through the NGOs, the surprise thing is that the cost of PrEP is really cheap and pharmaceuticals make a lot of money there. So you can get PrEP for really 700 and 800 rupees a bottle. But you need to know where to get it from. So again, uh, talk to organizations like Humsafar Trust. Your doctor might not be giving you the best outlet to purchase PrEP in terms of affordability. So you might want to go to a general physician or your own doctor for your comfort. But when it comes to purchase of PrEP, which is a long-term investment because you're going to eat one pill every day, it is better to obtain medicines through sources which can give you for cheap. So I think that's all. If I've missed something, I think
So,
everyone can add.
yeah, so I want to ask something. Maybe you can answer. So, sorry. Um, we spoke about cost. I think also I've noticed cost sometimes goes more than that, up to 2,800 to 900 as well. I've seen when I was not able during lockdown, when I was not able to access my free PrEP, it was almost
Yeah.
3,000. No, I don't think I myself didn't want to buy it for 3,000. So that plus, is there a list like some of the names you took before organizations for testing? I don't know are they there every part of India? Like, is it there in Bangalore or Pune? I'm not sure. I've not heard that name. So
So, which name are you saying? Healthians. Healthians is an
yeah.
online portal.
Oh, okay.
Um, so they don't have a physical lab anywhere, but it's a complete online thing. It's like big basket of tests, so you can get any test done, and the
Okay.
service is very good. A lot of organizations might be offering their own testing facilities and home collection facilities, etc.
Okay.
But Healthians, I think, is it's almost there in all the metro cities for sure. That's
Okay.
what I
Maybe I've
remember.
not heard about them.
Yeah,
So
yeah, yeah. It's there
yeah.
in Pune. We have
It's a
prescribed people in.
newish initiative, but
It
yeah,
is, it is, it
it's
is.
very very cost effective. I didn't know about the haggling part. I probably will use that the next time.
We have haggled a lot with them because no one wanted to get on PrEP because the tests are so costly.
Yeah.
Uh,
Also, I've recently heard about. We had a call last week to collaborate with them. So I've heard about this self-testing kits for HIV. Could someone add more on those?
so I'll
I think
just,
it's
Okay.
a mess
I
for
mean,
me. Yeah.
let's jump to HIV/ST before, and I'll just conclude on the PrEP bit.
Yeah.
If you're in a study like you were, Sham,
Yeah.
I think you should get in part. I mean, you should enroll in such studies if you have intentions and capacity to buy PrEP after the studies are finished. So that's a sustainability question that comes along with all the studies that happen on PrEP or on HIV where any free services are provided. So I don't know what Shruta will think about it, but but if you are participating in any study, don't just participate because it's free, but because number one, you need it. Number two, you will probably continue to need it and you will have the capacity to actually buy it. So, I mean, if you will read any affordability studies in India, most of the key populations are saying कि ये तो free में दो, जैसे government ART free में दे रहा है, वैसे ही PrEP भी free में चाहिए, तभी लेंगे. So, वो बहुत बड़ा सवाल है sustainability और cost का.
Yeah, true.
अब
Like
मेरा खत्म.
in case I talk about trans community, then they'll have so many things to spend on hormones, maybe
Yes.
PrEP if it is added, and then yeah. So it's
Right.
also
No, I was just agreeing. Sorry.
yeah. So I'm no, I'm just saying that it's okay. That cost, if we keep adding to our things, it can go to, I don't know what all would be added more.
नहीं इतना नहीं है. That's what I'm trying to explain. It's not that expensive if you know how to get that done. So that's why, I mean, don't fight this battle alone. It's an overwhelming battle. It's not easy. First of all, preparing yourself to be on PrEP, it takes a lot of mental effort. So find peers, find organizations who can help you procure PrEP on cheaper so that you can actually afford it and you don't leave it because it's costly. मतलब शुरू में जोश में शुरू कर दिया कि हाँ प्रेप करेंगे और फिर अब पैसा नहीं है, यहाँ खर्च कर दिया, दारू में हो गया, अब नहीं खा रहे प्रेप. सो ऑल ऑफ दैट इज नॉट नाइस. सो थोड़ा मतलब आपको तैयार रह के करना पड़ेगा कि अच्छा खानी है तो फिर खानी है वैसा.
So Shruta, is there a... Sorry, yeah.
No, I was saying adherence is very important when we start these medications.
Yeah.
No, it's key. It's key. Yeah. So, continuing with what Harsh has said, really, look.
Shruta, you're on mute.
See, I do this every time. It's like it's a ritual. So yeah, anyway, so right, so Humsafar does provide PrEP at a very nominal cost. It's 1,200 to 1,300 inclusive of the tests that are required to start it, and going ahead in the event that your tests are through, and all of that, I think it's 800 rupees a bottle. Okay, there is another agency called TAL Plus, TAAL Plus. They're based in Pune.
Pune, yeah. It's excellent, no?
They offer PrEP and PEP at nominal costs as well. So maybe Sham, I would probably connect you guys with the TAL Plus team, Taki. You can get PrEP and PEP at a discounted price. Maybe get the prescriptions part of it through as well, because they've got a doctor who sits and does all of that. I think a very important thing with PrEP is to remember that this is not something that you're going to need for a lifetime. Okay, you can go on PrEP, you can go off PrEP. Okay, but every time you do that, you will need to speak to a healthcare provider. A lot of people will be like, oh, I'm not going to have place for 3 months because mummy dearest is coming from village and staying with me. You don't have to take PrEP at that point of time if you know that you're not going to be at risk for 3 months, right? So for everyone who's going to going off PrEP thinking, oh my God, I have to take it for the entire year. Remember that if you feel you are at risk, you can stop, but consult a provider every time. Okay.
So, one question to that point. So what is there a time that they have to start before?
So depending on the kind of sex that they have, really, anal sex has lesser time, vaginal sex has more time, and to know about the time, we'll refer to this as harsh script. So but in all fairness, it's anything from 7 to 28 days, depending upon the kind of sex that you're having. But remember the harsh script and
the literature says that for anal sex it's up to 7 days, and for vaginal it's up to 20. But go to your doctor. That's what literature said.
You need to start 7 days before you do that. Sorry about it.
Yeah, and even after stopping PrEP, it's not like, oh, I had sex
you can
yesterday.
Immediately stop.
Yeah, and I don't feel like taking PrEP now. I'm going to go off PrEP. No, so there is a way to take
Stop
and get
start.
off PrEP. You have to follow all of that as well. So don't just tic tac nahi hai. So yeah, and one closing point, Sham, and a very important point for me is please people test. Okay, a lot of all of our internet studies indicate that out of 4 people who are at risk of HIV behaviorally, everythingly, one has gotten a test in the last 3 to 6 months. Everyone else assumes that they're negative. Okay, so in the event that you have sex with someone without a condom, the dude says, "Hey, bro, I'm negative." There's a very good possibility that the last test the person did was in 2017, right? So in the event that a condom breaks or you don't end using condoms, consider PEP as an option. Don't rely on the fact that, hey, the person in front told me that they are negative, because you just don't know what is the basis on which they've arrived to that negative one, right?
Yes.
Just that.
Yeah.
Your question was about HIV self-testing. I mean, it's a double-edged sword.
So before that, is there a list of these sorry, I don't know why my throat is suddenly. So is there a list of places, not only for Pune or Bombay, or is there a list of places where people can find out where they can get PrEP accessible and in India kind of thing, like, or a website or something that we can access?
So there is prep.yes for me that was built some time back, which does provide information for different locations. I don't know how much it has been updated since last I saw, but that definitely has numbers, and that definitely has a team that caters to almost all metro cities. So you can refer to that. But otherwise, I don't know any credible prep websites that are providing. I mean, I say a credible prep website when I would know the people behind it. I would say, like, I know these people. I know they will know what they're doing. So
Harsh, not everyone know people.
no, as a provider, let's say, or as a person who is working in this field, I mean, it's not a very huge circle. I mean, particularly to prep, everything is so new. Even pharmacies and the vendors who were excited, they were calling us कि लोगों को prep दिलाओ और हमसे खरीदवाओ. So it's a very very small circle.
Small. Okay.
Talking about Tal Plus, they also have their home collection. So Tal Plus is a very good source. It's in Pune, like she said. It's supported by the government of India, so there is sustainability also. That's what I know. So they also have their home collection, so you might not even have to go to Healthians or others, and you can just get it done there.
Okay. So for all the people who are watching, I'll make sure I'll get these names or make the panelists to put it all on comment, and we'll share it with you all, or it will be on the comment, and the video will be shared. The live video will remain on our social platform, so you all can also access it from there. We'll put it up in description. Yes, now we can move to the self testing. So it'll be a little good information for people who are scared to get out and
Right.
go to a place. Yeah.
So self-testing, you can see some kits on Amazon, but again, Government of India has not officially said, okay, let's do self-testing. There are some pilots that are going to be done. There has been a lot of conversation about self-testing. Stakeholders are interested; they want to do it. So I think it's going to roll out sooner or later. Now, two caveats to self-testing. One, it will definitely increase number of people getting tested because you are anonymous. You don't have to go anywhere. You can get it done on your own, and you don't have to share your result with anyone. So that's very very important. And the counter side of this is that what if I'm positive? What if I don't have support? I don't know whom to speak to. I spiral into depression or stigma, and I self harm, or I don't start my ART. Right. So that's very, very critical. That if you are positive, let's say, you need to start your treatment immediately. And even people who are found positive at centers, any center, private, government, NGO, there are so many dropouts. It's really hard to convince people to start ART, right? So that's the counter side of HIV/ST. John, would you have some perspective on how it's going in USA?
Yeah, so here in Arizona, about 3 years ago, we started a home test kit program where you could go to a website and order a home test kit for free, and it would be mailed to you. And we bought 500 kits, and we thought that it would take about 6 months to go through all of those kits, and we ran out within 7 weeks. And so for exactly the reasons that you say, you do it in the comfort of your own home. You don't have to tell anybody that you're taking the HIV test. You can have a friend or family member there. It's easy. There's various different types of tests available. So it really works well for folks who can't get to a medical provider, are afraid of going to a medical provider, or have shame
to be
for some
outed,
reason.
in India particularly.
Yeah,
I mean,
and then you talked about the importance of going back in. I think one thing that's important about a self-test kit is that it only indicates whether you're positive or negative. It doesn't confirm that you're HIV, that you have HIV. And so if it does say you might have HIV, you do need to go to a doctor and have a confirmatory test and then start your medications if that's true. It's very, very rare that happens. Usually if it indicates that you're HIV positive, you most likely will actually test positive, but there are rare instances where that's not the case. The good thing that comes from that as well, too, is that you know what testing's like, so maybe you won't be as scared to go to an office to do that. It also gives you options to start PrEP and really think about how to live your life healthy and well. So. And they're very, very, very easy. One uses it's almost like a toothbrush and takes a sample of the cells from your saliva and your gums. And that one takes about 20 minutes. There are some where you prick your finger as well, but some people don't like even a little bit of blood, seeing a little bit of blood. So the other one works better for them.
So, I mean, what John has pointed out is very important, like a confirmatory test is required. Now, that concept is slightly complex. I don't think we'll have enough time, but
Yeah.
I think Vijay can very quickly like just drive it through like the basic and confirmatory test.
Yeah, so basic test, like I think you or Shruta would be the right person to talk about it being helpful.
I can go as well. Yeah. So
Yeah,
look,
please.
basic tests are basically, I mean, as I said, they do catch infections. They're just to indicate whether you are positive or not, and confirmatory tests are done in a more standardized, in a more scientific manner, and with kits that have been validated, probably have greater sensitivity and specificity, and give you an accurate result. So that's basically the difference in a nutshell. And as Harsh has indicated, HIV self-testing kits are currently not available in India. There's a very strong global push to get the saliva-based testing kits out. We are trying our level best to get these approved under our DCGI guidelines. Humsafar is very soon going to start implementing an India-wide study that's going to look at acceptability of kits where we are going to make kits available, not just ask people whether they like it or not. If the kits are going to be available as well, and yeah, so there is progress happening on that front. I think one of the key takeaway messages, and this is where I feel we worry about people dropping treatment and basically going into a closet or attempting self-harm after they realize their status is. Look, HIV is an infection. It's a very manageable infection. Uh, while I understand that there is a lot of stigma that should not be there for HIV, medically HIV can be very, very easily managed. There are amazing drugs that are out there and that don't hamper your quality of life. So knowing that you have HIV can be difficult, but it's important to remember that treatment options are excellent, and the sooner you get on treatment, the better is the outcome. So look at it as an opportunity in the event that HIV self-testing does come out, in the event that you decide to get for a test. A negative result is great, but a positive result is not the end of the world, and things can be managed. So just get tested irrespective.
It interestingly circles back to the original foundation of work on HIV, that it should not be stigmatized. It's okay to be positive. It's manageable. I find it very interesting.
No, of course. I mean, the kind of fear-based messaging that goes out, around testing positive is that's what's worried me a lot about the way the interventions in India used to be structured, or outreach messages that don't get HIV. And then when a person tests positive, you go like, oh, this can be managed, and the person was like, why the f were you scaring me all this while if this was manageable?
ABC.
There are
ABC of
reasons
happiness.
why it's key to be negative, but in the event that you're positive, things are like it's not going to be the end of the world, right? And just get on treatment. There's so much that John's generation has done for us.
Yeah.
Not so that we can stigmatize HIV today, not in 2021, not even back then, but especially not today. So yep.
Yeah.
Yeah.
So before we end, I think we got few questions. So let's answer them and we go away. It's important, I feel, to answer these questions. So I'm sharing it on the screen. Is there any chance? Okay. I know we get this
It's a
a lot. Yeah.
taste or drunk. Huh? I didn't get it.
So, okay, so I think what they're trying to say over here is that can you get HIV by oral sex if you swallow someone's cum? A very, very, very little probability, possibility. I would be more worried about STIs. They can be a bit of a pish. So
See,
yeah.
but from
So
oral, you have to worry about your mouth ulcers and oral hygiene, of course.
yeah,
If you have mouth ulcers and if there is possibility of exchange of fluids, I mean, I wouldn't discount that as zero, which I hear a lot that, oh, oral se nahi hota, oral se nahi hota, oral se nahi hota. But you have to ensure that your oral hygiene is all right and you don't have any ulcers or, yeah.
yeah, and if you're drunk, by drunk, if you mean if you're buzzed, if you've had alcohol, look, alcohol itself doesn't increase your probability or possibility of acquiring or transmitting HIV. But a lot of people forget what happens, when they are drunk. Well, we've all had those times where we've been blacked out, but then sometimes, it can be anything from the force of the interaction to sexual coercion to the use of condoms, all of which can probably be compromised when you are in a state of intoxication.
Yeah.
So,
And I think I've shared one more question.
Yeah, that will require another half an hour.
not taste since one second. I'm trying to understand one second.
I mean,
Oh,
HIV
so
being symbiotic or asymbiotic.
there are no symptoms of HIV, Prasad. A lot of people say that you people will experience fever and diarrhea, and and a lot of people wait, and because they never get those symptoms, they assume that, hey, I never got a fever. I've never had diarrhea since the age of 3, and all of that. But a good number of people who actually test positive for HIV report not having experienced any symptoms while they have turned positive. I think that's what you were trying to ask.
Yeah,
If
I also
I've
guess the same.
misunderstood your test question, yeah, correct me.
No,
Most
I
of
John,
the
guess
is
that.
there anything that you'd like to add to this aspect? You've worked a lot more than any one of us have, really.
Yeah, so my personal experience was I had no idea whether I was HIV positive or not, but I knew that I had had unprotected sex and I felt it was important to get tested for HIV. So that was my personal experience. I'm actually working right now with a group of young people who are age 18 to 30 that are living with HIV and have been diagnosed within the past couple of years. And only one of them, one of the 6 people that we've interviewed right now, excuse me, said that they felt sick enough that they needed to go to the doctor, and the doctor said maybe we should do an HIV test, what have you. So for the most part, very, very few people, I think, have anything physical that tells them that they might have HIV. It's really important to just go and if you're sexually active or have other risks for acquiring HIV, to get tested for HIV regularly. So.
Yeah, thank you so much for that. I won't force you all with any more question. So I would like to thank all of you all for joining us today, all the panelists. I'm sorry, I'm just jumping. We have way gone half an hour more than the schedule. Sorry to keep you all waiting for an additional 30 minutes. And but it was very sweet that all of you all answered questions from all the comments that we received from people. The live was being streamed at almost Facebook, YouTube, Instagram, and also my personal Instagram. I wanted it to be shared there too. So thank you all of you all for joining us. And there's a small gift from Queer Bazaar for all of you all for coming here and supporting us. So you'll be receiving these in your emails, the same email chain. We'll share it with you all. Just for John, it'll be a little bit different. We'll be Queer Bazaar is not yet shipping outside, so we will have something else sent to you, not something that we make. So thank you so much once again. In case you'll have any other last message for the audience, we can share it. Sure, Vijay.
So yeah, so what message I have right now is we all keep talking about stigma, and right now we all know so much about HIV. In the initial time, When I came across one such instance when my friend tested positive, I had no knowledge about it. But right now, we are really lucky that institutions or organizations like MIST and Humsafar and Divine Desires, we are coming up and we are actually talking about these things. And trust me, it's only us who can who can kill this stigma, or who can minimize this stigma. Like I personally have friends who are positive, and it is not different. So there's no need of being scared from these people, and it's just very normal, and only me and you can do it if we are all together. That will also help people to get connected with ART and with medications. So that is
Thank
what I
you.
wanted to say.
Anyone else? Any last words?
So I would say one of the earlier questions talked about like, what can I do to, what can we do to promote PrEP and PEP more? And I would say this, learn about PrEP and PEP, but you don't have to become an expert, but become an expert in a couple of like 1 or 2 points about PrEP and PEP, and then share those with other people and ask them questions, share them with your friends on WhatsApp or TikTok or Facebook or whatever you're using, and just say, hey, I attended this great webinar. I heard this. What do you guys think? Just really start conversations just very naturally with folks to just get their perceptions and then share something that you've learned. And the more that we start to let other people know what's going on, we'll see more people going on PrEP and more people using PEP if they have an issue that they need that for. So.
Thank you. Anyone else?
Nothing, just educate yourself, don't be ignorant, and have fun.
Yeah. Get tested again, going back.
Yeah, get tested. Yes,
Get
yes,
tested.
regularly.
Yeah. Thank you so much for all of you for being here. And I would also like to thank all the audience for joining us today, for signing up for this, for the film festival. Do follow us in case, even if you are not registered for film festival, these live or all our panel is on our social media. Thank you for being there, supporting us, contributing to the festival. If you have not and you like our work, please go contribute. Also, thanks to all our sponsors, that is Barclays, Working with Pride, Leading with Pride, IBM. Thank you and Publicist Sapient. Thank you so much for being with us, partnering with us for these events and helping us make sure we spread awareness and stories to the world. Also, to the entire team of Out and Loud, thank you so much for helping us make sure sit back and sending us comments from Instagram, because it's not linked on this tool. So helping us bring panelists, the entire team, thank you so much for joining us. Special thanks to Dwight for putting across this beautiful panel and helping us make this available to a wider audience. Thank you, everyone. And next, I would also like to tell you all, on the 13th, we are talking about vaccination for the LGBTQIA community. So it would also include some of the questions you'll ask today about people on HIV, maybe people on PrEP, ART. It also talks about people going through hormone therapy. So we'll talk a little more in detail about the vaccination and the LGBTQIA community. And we also will start our movie screenings with keynote address by Devdutt on the same day, on 13th. So please register for the Out and Loud Pune International Queer Film Festival. It's very simple. It's on our website. It's just lgbtq.co.in. Thank you once again, everyone, and have a wonderful day. Take care.